Good day to the evaluators. My name is Rishika Sivanathan. Today I'm going to present my poster which entitles Automation in Hematology, Hematology Lab Management and Equipment and Quality Assurance in Hematology. As for the introduction, the hematology lab in a healthcare setting is concerned with the diagnosis and monitoring of diseases of the blood and blood-forming organs. Biomedical scientists carry out a wide range of laboratory tests to produce and interpret results that assist in the diagnosis and treatment disease. Traditionally, blood tests are performed in a centralized laboratory by specifically educated, trained, and registered practitioners who are usually biomedical scientists. Technological advances have led to the development of portable analytical devices with limited or single test repertoires that allow basic pathology tests to be performed away from the centralized laboratory, either at the bedside, in the outpatient clinic, or in the general practice. Thus, the objective of this major project to create or design a functional hematology laboratory which covering routine testing and advanced analysis for anemia-related diseases. Next, I'm going to explain on my flow sample or design of hematology lab. The flow sample divided into three, such as general administrative and public areas, clinical working area, and support service area. The general administrative area comprises receiving of sample, releasing of results, records area, and specimen collection area. Next, the clinical area comprises clinical microscopy section, clinical chemistry section, immunology section, hematology section, flow cytometry room, and sample processing room. In support service area, this comprises the sterilization room, emergency shower, hand washing area, storage area, fire exit, and base holding area. Let's look into the clinical working area. There will be 4 tests carried out in the hematology section, which are ESR or coagulation test, complete blood count test, and HbA1c test. The erythrocyte sedimentation rate is the rate at which red blood cells settle in a column of blood in 1 hour. The instrument that can be conducted this test is Halifax Test 1 ESR analyzer. This instrument can run up to 160 samples per hour. Next, coagulation tests include activated partial thromboplastin time, prothrombin time normalized ratio, and thrombin time. These measure the proteins involved in forming of blood clots, proteins that influence blood clotting, and time required for typical processes of blood clot formation. The instrument will be Sysmex CA101. This instrument is straightforward, complex semi-automated coagulation system which designed to simplify coagulation testing, which making more standardized and reproducible. This instrument can run 30 tests per hour. Next, complete blood count tests. These include hemoglobin, hematocrit, mean corpuscular volume, mean corpuscular hemoglobin concentration. These tests can be conducted by XN2000 CBC Haematology analyzer. This analyzer can run up to 200 samples per hour. Next, HbA1c test. As we know, HbA1c test basically will be used to measure blood glucose level. But in iron deficiency, red cell production decreases and consequently an increased average age of circulating red cell ultimately leads to elevated HbA1c level. Hence, in people with mild anemia, HbA1c can use as diagnostic tool for diabetes. The analyzer will be TOSO HLC723GX analyzer. This produces stable HbA1c results with variant detection in 2.2 minutes and generates the first results in 6.6 minutes. Moving on to the next section, which is immunology section. In this section, iron profile and thyroid function tests will be carried out. These include serum iron, ferritin, and total iron binding content. And for thyroid function tests include tyrosine and thyroid stimulating hormone level. The instrument will be Unicell DXI 800, which produced by Beckman Coulter. This instrument can run up to 400 tests per hour. Moving on to next section, which is clinical chemistry section. Liver function tests will be carried out in this section. LFT panels may vary, but should include calcium, transminases, total protein, bilirubin, albumin, and alkaline phosphatase. Additional tests that may provide information about the liver function include lactate dehydrogenase, gamma glutamyl transferase, and 5-nucleotidase. The analyzer that used are AU480 chemistry analyzer from Beckman Coulter. This can be run up to 400 photometric tests per hour and easy to operate. Next section will be clinical microscopy section, where peripheral blood smear or bone marrow smear can be conducted. Peripheral blood smear will be done for microscopic evaluation of red blood cell morphology, while bone marrow smear to diagnose bone marrow disorders. The instrument named Sysmex SP1000I, it provides rapid automated preparation of peripheral blood smear to help laboratories meet and standardize smear review turnaround times. The last section in clinical area will be flow cytometer room. In flow cytometry, microscopic particles are optically analyzed as they flow through the detection channels of the instrument. The instrument called PS10, which uses flow cytometry technology in its hematology to detect RBC-bound IgG antibodies for the diagnosis of autoimmune hemolytic anemia. This instrument has a capacity to run 48 tubes per hour. Moving on to the quality assurance of hematology lab. Basically, the ultimate goal of quality system is to obtain test results that are reliable, relevant, reproducible, and as accurate as possible. This should be done by monitoring and assessing the quality of the testing process in pre-analytical, analytical, and post-analytical phases. The pre-analytical phases encompasses components such as training, specimen collection, labeling and transport condition, processing of specimen before testing and storage, sources and types of specimen tested, selection of test kits, and checking the expiry date of test kits and recording of information. While the analytical phase encompasses the testing process itself. Some of the components to be reviewed by the QA program include written standard operating procedures manual, reagent preparation, testing performance, correct use of reagents, inclusion of internal or external QC in the test kits, and lastly, QC monitoring procedure. The post-analytical phase encompasses all that occurs after testing, including interpreting results, recording results on the correct identified code, reporting results, entering data into the tracking system, maintaining records, and reviewing QC. Next, regarding laboratory precautions and management, safety precautions are essential and should be followed at all points in the testing process from specimen collection to testing, storage, and disposal of biohazard wastes, which is to minimize occupational risk. When specimens are received in the laboratory, should be handled by wearing glove, laboratory coat, and other protective clothing in accordance with the type and condition of specimen. Sample should be sealed and need not be stored in an alphabetical order. Storage can be in the basis of priority in separate bins which can identify the most urgent, urgent or normal priority. Furthermore, proper disposal of contaminated laboratory waste is essential. All contaminated waste in the laboratory should be decontaminated before disposal, and these include specimen of body fluids, broken glassware, and containers of contaminated needles. Materials that are discontaminated or disposed of outside the laboratory should be placed in a strong, leak-proof container prior to transporting them outside the laboratory. In this hematology lab, there will be a software system known as Laboratory Information System called LIS that records, manages, updates, and store patient testing data for clinical, including receiving test orders, sending orders to laboratory analyzer, tracking orders results, and quality control, and transporting the results to an electron health record. So these are the references. That's all from me. Thank you.